Hey everybody, this is another episode of How to Pass NCLEX and also Monday Motivation across the nation. I am your number one NCLEX instructor. My name is Regina Callion MSN RN, and I have free NCLEX questions for you today. So we have a great program. Our topic today, you guys are going to love it. It is nursing priorities. We've been doing this, but I want to stay on here because last time people got a lot of these questions wrong. So we're going to try it again this week. Our Monday motivation is this: the time is always right. If you are looking for a free NCLEX review, hey, I have one coming up. It is called Love Your Content. It's Valentine's Day weekend, so we see a lot about love, love, love. So how about we love something that's going to really love us back, and that's our nursing license. So sign up for the NCLEX Maternity review. It is going down Valentine's Day. ReMarNurse.com/love is the way to sign up. And if you're watching this on Facebook, if you just comment hashtag LOVE all together, we will get you signed up. And so again, that is happening. That's going to happen Valentine's Day and the day after Valentine's. So I'm going to give more information about this free NCLEX review at the end of the show. But right now it's time to get into the questions. Here they go. First question is this: a nurse is ending her shift and has to assess 4 clients. Which client should she see first? Is it number 1, the client with intestinal bleeding and complaining of vomiting? 2, the client with right lobe brain tumor and complaining of vomiting? The client with pancreatic cancer who is receiving chemotherapy and complaining of vomiting? Or 4, the client with a new left kidney transplant and complaining of vomiting? What is the priority patient here? You got 4, and they all are coming in with the same kind of issue. Everybody's vomiting. Everybody's vomiting. Who should the nurse see first here? And I see the answers on the screen. Hey, share this video, tag your friend. I want to make sure that our community is growing in 2022. So if you love free NCLEX questions, I bet you know somebody else who does too. All right. I'm going to give you guys the answer in 3, 2, 1. The priority patient is absolutely number 2, the client with a right lobe brain tumor and complaining of vomiting. Okay. And the reason is because this client, we don't want them vomiting because of increased intracranial pressure. And so we need to reduce that situation for this patient. They already have a brain tumor. We don't want them vomiting on top of having a brain tumor. And when we look at the other patients, everybody else is vomiting too. So you really want to think about, okay, where is vomiting expected and not expected? Because that is a way to look at priority questions. So let's take a look at the other options. We have number 1, do you have vomiting with intestinal bleeding? If a patient comes in and they have intestinal bleeding, would we expect them to be vomiting? That answer is going to be yes, we would, right? We would expect them to be vomiting. What about the patient with pancreatic cancer who is receiving chemotherapy? Should that patient be vomiting? Chemotherapy is going to make you nauseous. Yep, that's right. And then left new kidney transplant. A lot of people, and I see there is 1 and 2. A lot of people pick this one, and you may have thought, okay, it may be an organ rejection, but actually when you have a new organ, you guys know you're on a lot of different medications to suppress the immune system so that the body accepts that new organ, and that can cause nausea and vomiting. Yeah, so the aftercare of an organ transplant is something that you should be familiar with. You're going to be on a lot of medications so you don't get an infection, and so your immune system doesn't attack that organ. So you'll have nausea, not, what is up with that word today? You will be nauseated and you will have vomiting. So the correct answer again is a patient with the brain tumor. We don't want that patient vomiting. All right, next question, priority wise, here we go. Oh, this is a good one. A nurse is beginning her shift in the ER and has to see 4 clients. Which is the priority client? Is it going to be 1, a client with no sensation and no pulse in the right leg? 2, a client with a knife wound to the chest? 3, a client actively bleeding from the nose after head trauma? Or 4, a client with a gunshot wound to the upper left extremity? Wow, these are all serious patients. I see why this is the emergency room. So look at the patients, look at the presentation, and tell me what is your priority here. You can do this. I want you to pretend like you are taking the NCLEX exam. You are going to go with your second mind, and you are not going to question, read too deep, get anxious. This is it. You can do this, guys. All right, I see the answers on the screen. Lots and lots of different options, but everybody, I think if we really think about this, we can come to the agreement that number 2 is going to be the right answer. Absolutely. If you think about airway, breathing, circulation, this is a great way to break down this priority situation here. So 2, they have a knife wound to the chest. So that is going to impair breathing and gas exchange. Is there anyone else more important than that right now? Number 1, if a person has no sensation and no pulse, what is that? Is that airway, breathing, or circulation? If a person has no pulse and no sensation, is that an airway problem, a breathing, or circulation? Absolutely, that is a circulation problem. So that's not going to come before breathing. What about 3? A lot of you guys may think number 3 is the right answer because you see bleeding from the nose. But, is that a breathing problem or is that circulation? Okay. Anytime you see bleeding out, whether it's from the nose, the arms, the ears, it doesn't matter, the teeth, that is going to be a circulation issue. Okay. So the nose was kind of a distractor, but it's definitely a circulation problem. And then, so number 4, again, we have a gunshot wound. Where is that gunshot wound? It is the upper left extremity, So that's the arm. So again, looking at all these clients, number 2 is the priority. Come on, we're moving on. I like this next one. It is this. The best roommate for a client with leukemia is it number 1, a client with Cushing's syndrome? 2, a client with chickenpox? 3, a client with thick green mucus from a runny nose? Or 4, a client with a ruptured appendix? Oh, I want to know, who do you think the best roommate is? This is a great priority question because you can't get this one wrong. You have to know about safety and infection control here so that you can prioritize which is the best roommate for this patient. So if you think about with leukemia, you think about the other situations, this is a pretty straightforward, easy question because you cannot just put a leukemia patient in a room with everybody, right? They have certain precautions and you want to protect their what? What needs to be protected if a patient has leukemia? It is going to be their immune system. So the appropriate patient is the Cushing's syndrome patient because they are both immunocompromised. Yeah, the clients with Cushing syndrome is also immunocompromised. So we want to put those two together. So if you didn't know what leukemia was, please make make time to look it up, because you may definitely see that again. If you're not familiar with the side effects of Cushing's syndrome, study them. If you have the virtual trainer, you will come across this in my NCLEX review. All right. And the other patients there, they wouldn't be appropriate because, again, we're trying to protect an immune system of our patient with leukemia. So a person with chickenpox is going to need isolation, respiratory level. A person with thick green mucus, they are not going to be appropriate because we don't know if they have some infectious process. And number 4, a client with a ruptured appendix, they're going to have a lot of, vomiting potentially. And so we would not want them in a patient who had an immunocompromised situation going on, sharing a bathroom, those type of things. Okay. All right. Good job, everybody. I'm so glad you came today. I'm so happy about that. Number 4 question coming up is this: priority. A 55-year-old man is brought to the emergency room, unresponsive and combative. The client is diagnosed with hyperglycemic, hyperosmolar, non-ketotic syndrome with a blood sugar of 542. The client's current weight is 287 pounds. Which is the priority nursing action? Number 1, prepare the client for intubation to establish an airway. 2, start an intravenous infusion of normal saline. 3, consult the endocrinologist to adjust the dietary needs of this client. 4, administer 25 units of insulin glargine, insulin sub-Q. Okay, what do you guys think? I'm putting I'm putting something out there. This question is solely based on content. There's really no critical thinking here. This is a content-based question because you have to know what HHNK is. You have to know what that syndrome is in order to figure this out, right? So if you know that, you don't need to do any kind of tricks or tips or anything. You just know how to be a great nurse based off of your pathophysiology. Okay, so what do you guys think? If this client came in with the presentation, are you going to number 1? Are you going to 2? Are you going to 3? Or are you going to 4 in this scenario? Quick how to pass NCLEX episode. This is what we do here at ReMar. If you are a ReMar nurse, you know this is our habit. We get into it. And the correct answer is going to be, did you get this one right? It is actually number 2, because this hyperosmolar non-ketotic with a high blood sugar is going to be the result of dehydration, right? And so we need to get some fluids into our patient. And remember, with NCLEX, you are picking the best option from what you're given. So I don't want you to be into the habit of saying to yourself, well, why doesn't it say this? Or I wish this answer was there because then I would know it. When you're taking NCLEX, you don't have time for all of that. Don't even go down that road of wishing and hoping and wanting because it's not there. So what were you given and what is the best choice from what you were given? And that's how we come to number 2. So if we look at number 1, it says prepare the client for intubation to establish an airway. Well, that sounds great, right? We just talked about the ABCs and how airway is a priority, but that's not what is needed here. This patient, they're unresponsive, but they're combative. So that means that they're not responding to commands. Hey, Mr. Jones, settle down, put your arms down, roll over. Like they're not doing any of that. They're combative. They want to get you away. They don't want you to touch them. And we know that can happen if a patient's blood sugar is too high or too low, right? And so here, this is not the time to intubate this man. This man doesn't need intubation. The blood sugar is 542. So they need regular insulin or they're going to need some IV fluids. All right. And so we have the choice of starting the IV fluids as number 2. That is why it's correct. Number 3, consult the endocrinologist. Yes, we can do that, but it is not the priority. Number 4, some people may have thought because that said insulin and give it, that it was appropriate, but what type of insulin is that? That is the long-acting insulin. So it's not going to produce the response that we need for this patient. We would need a regular insulin to give IV to bring that blood sugar down, okay? So that wasn't the choice there. It wasn't appropriate to go with number 4. All right. Hey, I got one more for you. And it is question number 5, and it says this. A nurse is being discharged and, I'm sorry, not a nurse. A client is being discharged and has a question about 2 diagnoses that are written on his chart. Who is most appropriate to educate this client? Okay, we have it. Got questions about why they were given a certain diagnosis. So, who is most appropriate to educate this client? Is it 1, an RN, 2, an LPN, 3, the charged nurse, or 4, the healthcare provider? Who would you say? This is definitely critical thinking, because you have to know within the scope of practice who does what. And sometimes those lines are blurry, right? I try to tell you guys as much as I can to prepare you, but NCLEX is about tricking. Oh, I don't want to say that. NCLEX is about putting you in unfamiliar situations. All right. It's not to trick you. It's really just to test your knowledge. So who's most appropriate in this situation? I sure hope you picked number 4, the healthcare provider, because it is the responsibility of the physician to explain the reasons why they wrote a diagnosis. We don't do diagnoses as nurses. All right, the healthcare provider does them. Hey, if you want more questions like this one, check out my question bank. It starts at just $29, and you can get an additional 1,200 NCLEX questions, and you get to pick the topic. So check it out at remarnurse.com. remarnurse.com. Also, I am still happy to say that we have quick facts for NCLEX in stock and available, and you can pick that up on Amazon, the 5-star version, or you can get it at, again, our website, remarnurse.com. Quick Facts has a ton of information about pharmacology, your clinical skills, and general nursing knowledge that you definitely need to know if you're in nursing school. So check it out. The comments are great on Amazon, and it is available right now. Our Monday motivation today is the time is always right. The time is always right. And I want to ask this question. Many of you may not know this person, but I know that there is one person out here who does know who this is. If you know who this is, please just tell somebody right now. Who is this? Who is this mystery woman? Is this a famous chef? Is this an actress? Who is this person? Who is this person? I love those glasses that they are wearing. I think they're so fashionable and fashion forward. You know who this is. And there's a reason that I'm going here, so just stay with me. This, in fact, is Rosa Parks, right? And so she is famous because on the evening of December 1st in 1955, not too long ago, Rosa Parks, an African American, was arrested for disobeying a law at the time that required black passengers to relinquish seats to white passengers when the bus was full, right? So in other words, if a black person was sitting down and a white person came, the black person would have to get out of their seat to allow that white person to sit down. And blacks are also required at the time to sit at the back of the bus. And so one of the things that I try to do during Black History Month is I try to either learn about new people, right? Because sometimes we can get presented the same facts over and over again, which are very important to remember. And I think sometimes we have to be reminded of them because we tend to forget so quickly. But I wanted to point out something very interesting about Rosa Parks that maybe a lot of people didn't know. And so when we think about Rosa Parks, we really think about the incident on the bus. We really think about that one fateful day where it seems like she took a stand, right? And said, no, I'm not doing this anymore. I'm tired. We see her as, an older woman who is just tired at the end of her workday, and she's just fed up and saying no, right? That's the Rosa Parks that we think about. But actually, what I found was really interesting was that Rosa Parks, she actually joined the National Association for the Advancement of Colored People, right, in 1943. In 1943. So catch that. This was 10 years before the bus boycott. All right. So this is a person that made a decision that she was going to stand up, that she was going to fight for something long before that opportunity to make a stand came. All right. She already 12 years prior, it wasn't, I'm trying to get you guys to see that this did not just happen off chance. She was not this person. She was not this person just off the cuff one day. I've had enough. Like, we always think of Rosa Parks as like this little old woman and she was just tired at the end of a long day. No, this was a very vibrant, this was a very, a very conscious woman who had the intentionality, who had the foresight to say, there needs to be a change. And for 12 years before that day, she had built up the habit of saying what is right, of doing what is right, of believing in what is right. And that is something that I will teach my children, that it's very difficult, to have courage just off chance. Like, you have to have strong principles. You have to have a solid foundation. You have to have consistency in order to be able to stand during hard times, right? Because ultimately what we're seeing when we think about Rosa Parks is this is a woman who has established a certain character about herself, right? This is a woman who was already believing in the vision, who already was attached to the goals. So for Monday Motivation, what I'm asking you is that what habits are you developing right now? What are you doing right now? What are you attached to right now that is supposed to be serving a purpose for you? Okay. And to take it a step further is, will you be ready when the time is right? And you guys know me, I'm coming from the NCLEX perspective. I'm talking about your nursing opportunities. What are you doing today that when it gets difficult, when you're taking your exam, you will be prepared for? What habits are you building today that when you are faced with a difficult patient, when the doctors can't really figure out what's going on with the patient, when the mother brings you in and said that the child is very difficult, they don't want to eat, they don't want to drink, how are you going to manage that situation? How are you going to do it? What habits are you building up? Are you patient? Are you kind? Are you educated? Are you forward thinking? Right? Because huge opportunities come up, and the best way to be prepared for them is to have imagined and worked hard for them. That's the best way to do it. And so I'm asking you guys that today. Will you be ready when the time is right? Okay. And so as you think about it, I'll just leave you with the words. This is in honor of Black History Month. Of course, Martin Luther King, he said it the best. He said this: the time is always right to do what is right. So you don't have to worry if you are in endeavoring to do the right thing. You don't have to worry about, oh, is this the right time for me to do it? Should I be doing this right now? If you are trying to do what is always right, then you're in the right place. And I like this colored picture of Martin Luther King because we mostly see our historical Black figures in black and white, right? We see these black and white photos of them, and it makes it seem like it happened such a long time ago. It didn't. There are people still alive from 1955. Why is this picture in black and white, right? Why do we see them in black and white when they had the ability to be in color? Okay. And so, again, we really have to, during this special month, especially Black History Month, we really have to take a second and we really have to contemplate, what sacrifices have been made for us to have the privileges that we so quickly take for granted. Your vocation to be a nurse, the opportunities that you have to literally work in any hospital. Is it going to be easy? No, probably not. But are you able to do it? Are you able to overcome the challenge? Can you be courageous and brave like Rosa Parks? I think you can. And so this week for Monday Motivation, let's look at our habits and let's make sure that our habits are aligning with the character that we want to have. So when the opportunity is right, we can do what we came to do, right? Passing NCLEX is definitely one of those things. So thank you for attending How to Pass NCLEX. This episode was sponsored by, let me get it. Hey, the #1 training system to pass NCLEX in 4 to 6 weeks or less. That is my NCLEX virtual trainer. Get into it. If you need to renew it, go ahead and do what you have to do, because this training system really prepares you in a holistic way for the exam prep. All right. And one more thing before I go is that don't forget, as you're doing the virtual trainer and you want to focus on a little bit of your maternity, your sexually transmitted diseases, and your pregnancy, I am planning to spend Valentine's Day with you guys for the Love Your Content maternity review. So I want you to sign up for it today. If you hashtag LOVE on the screen, we will get you signed up. But also, if you're watching from YouTube, you need to go to the website to sign up. And that website is remarnurse.com/love. And I'm doing this Love Your Content review. It's going to be February 14th and 15th at 8 p.m. Eastern Time. So save the date, set your clocks, and I will meet you there. Everybody who signed up so far, you guys have your workbooks. They were emailed to you. So if you sign up now, you still have an opportunity to get those workbooks and get them printed out before the class. I want you to have them because we're going to do the lectures and we're also going to have some homework, practice exams. You guys know how I like to prepare you for an event that we do here at ReMar. So check it out. Go. And just plan for a great time. And it's free. I know you love the free things. So no excuses. Show up. Let's show out together. Let's pass NCLEX this year. You guys know we always say this. If it's your first time, it's super easy. Say it with us. I can, I will, I must pass NCLEX.